Courtney. Thank you so much. Okay, so our subject today is phosphorus in the dialysis patient. So our objectives are going to be, we're going to first of all define phosphorus and the derivatives of it and how it works in the body, the treatment for the control of high phosphorus levels, and recognize the names of phosphorus medications used in dialysis. So we're talking about dialysis patients, but you know what? We have to look out for our phosphorus too, because there are so many of the foods we eat now that has hidden phosphorus in it. So I'm going to go over that too. I was actually surprised. I do have a couple of pictures over there that you can look at, and I bet you'll be surprised as well when you see some of the things that we eat that has hidden phosphorus in it. And guess what? It affects our kidneys as well. So we need to look out for ourselves as well when it comes down to phosphorus. So what is phosphorus? Phosphorus is a mineral that's found in your body, and it's virtually in all living organisms, and it's in the majority of our foods. It's protein bound very largely, so it travels along with protein, and that's why it's so difficult too to remove from our patients, because we want our patients to have protein, right? But we tell them, you need to lower your phosphorus, but you need to increase your protein. So there we go again. And that's why it's so hard sometimes to control that. You have two main types of phosphorus. You have organic phosphorus and inorganic phosphorus. Which is the one that we want? Probably organic. We want the inorganic. The inorganic are the ones that come in our processed foods and foods that we shouldn't be eating. Fast food. We live off of fast food pretty much all the time now, don't we? We try to cook. I never have time. All right, I'm trying to do better though. So your organic now, that's the ones we want. That's the one that comes from protein-rich foods, animal proteins, such as dairy products, meats and fish, as well as plant foods such as legumes, nuts, and chocolates. Inorganic comes in the form of food additives and preservatives, such as in processed foods and foods that are color enhanced. So what it does, it makes our food look good, it makes our food taste good, right? Makes it appetizing. So phosphorus, the bioavailability of animal protein is higher than that of plant-based protein. Therefore, a mixed diet of animal and protein should be considered. Your normal serum phosphorus levels for us should be around 2.5 milligrams per deciliter to 4.5 milligrams per deciliter. Diet prescriptions should take into consideration absolute dietary phosphorus content, bioavailability of phosphorus, and phosphorus protein ratio. And I didn't want you all to have too much fun with that, so I didn't pull that ratio in for you, but I will tell you it's about 10 milligrams per gram. And that's just to say, now you're going to have both of them. Let's take, for instance, an egg. Okay, you're going to have both of them, right? But the one that's going to be the best ratio is going to be what? The part that I don't like anyway, the whites. I say, why everything just healthy, just not good. I like the yellow part. But that's the one that's going to have a little bit more in there. That's going to be a little bit higher. So, and that just goes to show when we're talking to and teaching our patients, we try to give them healthy choices. We know that that protein is going to follow that phosphorus, but we want the protein to be a little bit higher than that phosphorus level, because we're going to run into that anyway. And some of the cooking methods, such as boiling, can reduce the phosphorus content as well. Now, just a little bit about the absorption.